Yeah.
So we've got a word that you may not have heard, but the definition is the trending topic here.
Hmm.
Agoraphobia. What is agoraphobia?
Yes. So that is an extreme or an irrational fear of basically going into crowded places, maybe even leaving your own home, or being in places where it's like hard to get away from or difficult to escape. So it's a
Mm,
fear of just kind of being out in that open, and not being in a safe space. So yeah, the fear of public places, openness. Yeah.
mm.
Hmm.
What causes that?
Well, a lot of times there could be some other phobias that a person may have already, whether it might be or disorders. It could be a social anxiety disorder. There could also be just some other fears that that person might have. Um, the claustrophobia is another one where that's fear of enclosed spaces.
Hmm.
Um, or sometimes depression may kind of contribute to that as well. Sometimes when people have maybe a history of physical or sexual abuse, that may cause some fears about safety in spaces. And then sometimes if people have a substance abuse problem, there may be some connections with that as well. And then sometimes there's also, worth looking into if there is a family history of that as well. So some of that, we're talking about nature nurture. That might be more of the nurturing aspect, to where if that's what you grew up in your home, then you now have this fear of the same of how you grew up.
Hmm.
Hmm.
Yeah. So maybe somebody is watching or listening and they themselves are struggling with this, or they know someone struggling with this. What's some helpful insight from your perspective as a clinician, that can help with someone?
Yeah, well, you absolutely want to connect with a therapist who can be there to support you through it. Sometimes this might mean, a form of a treatment plan where maybe even medications might be necessary to assist you in that
Hmm.
process. But, this is also an amazing time to talk about it. We just talked about communication earlier, but, to try to talk about it when you are noticing that these fears are coming up. And so that might
Mm.
um, entail some calming skills. Maybe it's relaxation, journaling, like I mentioned, talking it through, talk therapy, but then also making sure that you're taking care of yourself, getting plenty of rest, having
Hmm.
support systems around you that might, maybe joining a support group where you can get that type of support as well, so that you are in a space where you're not in it by yourself. And that's so key, is to know that you're not alone as you
Hmm.
are journeying through this process. And so just really equipping yourself and recognizing, okay, well, how am I feeling? What are my emotions that are going on when I notice these fearful places, you know, um, but then also just, again, just getting that treatment with a clinician, with a therapist that can really help navigate that with you. So